Welcome back to VetiVerse, your veterinary learning space. Today, we'll discuss a dangerous disease called listeriosis, commonly known as circling disease or silage sickness. It mostly affects sheep, goats, and cattle, especially during winter and early spring when animals are fed silage. This disease causes nervous signs, abortions, and even death, resulting in serious economic losses. It's also zoonotic, meaning it can spread to humans. So awareness is very important. Let's learn about its cause, signs, treatment, and prevention in detail. Etiology. The disease is caused by Listeria monocytogenes, a gram-positive, facultative intracellular bacterium. It's widely found in soil, manure, silage, and animal feces, and it can survive for long periods even in cold weather. Spoiled or improperly fermented silage with a pH above 5 provides the perfect environment for this bacterium to multiply, hence the name silage sickness. Listeria can also infect humans through contaminated milk, cheese, or meat. Distribution. Listeriosis occurs worldwide, but it's most common in cold and temperate climates. Outbreaks often happen during silage feeding seasons, particularly when silage is made or stored in poor hygienic conditions. Transmission. The most common route of infection is through eating contaminated silage. Animals ingest Listeria bacteria from spoiled feed, dirty water, or through mouth wounds caused by rough fodder. After entering the mouth, the bacteria travel along the trigeminal nerve to reach the brainstem, where they cause inflammation, leading to the typical circling behavior. History. Listeriosis was first reported in the early 1900s. The bacterium was named after Sir Joseph Lister, the scientist who introduced antiseptic surgery. Since then, major outbreaks in ruminants have been recorded, especially after feeding of poor quality silage during the winter months. Pathogenesis. After ingestion, the bacteria invade the oral mucosa or enter through small cuts in the mouth. From there, they move along the cranial nerves, especially the trigeminal nerve, to reach the brainstem, causing meningoencephalitis. This results in loss of coordination, circling, and paralysis. In pregnant animals, the bacteria may spread via the bloodstream to the uterus, causing placentitis, abortion, or stillbirths. In young animals, Listeria may enter directly into the blood, leading to septicemia. Clinical signs. There are 3 main forms of listeriosis: nervous, septicemic, and abortive. Nervous form, most common, circling to one side, head tilt, and drooping ear or eyelid, facial paralysis, loss of balance or falling salivation and difficulty chewing, depression, anorexia, and finally, recumbency and death. Septicemic form, seen mainly in young lambs and kids, causing fever, depression, and sudden death. Abortive form, in pregnant animals, abortion occurs in late gestation, often with retained placenta or weak offspring. Treatment. Early treatment is crucial because once brain damage occurs, recovery is rare. Use high doses of antibiotics that can reach the brain, such as penicillin or ampicillin for 5 to 7 days. Oxytetracycline can also be effective. Provide supportive care with anti-inflammatory drugs like dexamethasone, vitamin B complex for nerve repair, fluid therapy, and nutritional support. Keep affected animals isolated and offer soft feed and clean water. Prevention and control, 540 to 640. Voice. To prevent listeriosis or silage sickness, always use properly fermented silage with pH below 4.5. Never feed moldy or spoiled feed. Keep feed troughs and silos clean. Don't feed silage to pregnant animals or young ones. Dispose of aborted fetuses and contaminated bedding safely. Disinfect sheds and equipment regularly. And because Listeria can infect humans, always wear gloves, wash hands, and avoid unpasteurized milk or dairy products. Ending. This was all about listeriosis, also known as circling disease or silage sickness in animals. A small mistake in feed hygiene can lead to big losses, but awareness can save lives. If you found this video helpful, don't forget to like, share, and subscribe to VetiVerse for more veterinary awareness and educational content. See you in the next video. Stay aware, stay VetiVerse.